Okay, for the otitis media, okay, it is the infection of the middle ear occurred as a result of a black eustachian tube, okay, preventing normal drainage, and a common complication of acute respiratory infection. And infants and children more prone because of their as eustachian tube are shorter, wider, and straighter. Okay, so yan yung picture natin, wherein the eustachian tube is blocked by an inflammatory tissue. Okay, ano mga common cause natin for this one? We have the bacterial or viral infections. Okay, we have the Streptococcus pneumoniae, Haemophilus influenzae, and the Moraxilla catarrhalis. Okay, for the risk factors for otitis media, we have a passive smoking and also being fed formula milk rather than the breast milk. And then yung pag-feed sa kanya is in supine position. Okay? And also having a cleft palate because yung muscles of the cleft palate are important in allowing air into the into the middle ear and also as well as the allowing drainage of secretions from the middle ear. Okay, when this process is interrupted, fluid can build up, what we call the otitis media in the middle ear. Okay, next one is having a Down syndrome also because mas narrow yung kanilang ear canals and they have a serious otitis media wherein it is the fluid in the middle ear. So next one we have the complications. Mastoiditis. Okay, for the mastoiditis, it is an infection of the mastoid bone of the skull. Okay, labyrinthitis. Okay, we have the inflammation of the labyrinth, which is the part of inner ear. And also meningitis, it is the inflammation of the protective membranes covering the brain and the spinal cord. Okay, we have the signs and symptoms. There is a fever as high as 40 degrees, irritability also and restlessness, rolling of the head from side to side, and pulling or rubbing the ear. Aside from that one, there is an earache or it is a sign of hearing loss, and the purulent ear discharges. Okay, we have the diagnostic for this one. For otitis media, we have the otoscopic exam, wherein it used to look the outer ear and also the eardrum, used for an assessment. Okay, this for the intervention, we have to encourage fluid, okay, upright position when feeding, avoid chewing because it increases pain, have the child lie with the affected ear, and also appropriate technique for clean drainage. Okay, and also administration ng analgesic and antibiotics. Okay, we have for the antibiotics we have 10 to 14 days, and screening for healing loss, and also for the myringotomy. So that is the interventions. Next one is the nursing management. We have the assess the child for fever and pain level, and also assess for possible complications, and administer the prescribed medications and reduce fever, reduce the pain, prevent skin breakdown. Okay, provide preoperative and also postoperative care, provide client and family teaching. So we will be doing a health teaching, or you will be doing a health teaching in every patient you will handle. Okay. So we have the meningitis. Okay, when we talk about the meningitis, it is the infectious process of the central nervous system caused by a bacteria and viruses. Okay, it is acquired as a primary, okay, or a result of a complication. The diagnosis is the CSF analysis, wherein increased pressure and also cloudy CSF and high protein and also low ang glucose content nun. Okay, next one is for the assessment for meningitis. It is a signs assess for a signs and symptoms vary depending of age group. We have the fever and chills, vomiting, diarrhea, poor feeding or anorexia, headache with nausea and vomiting, sensitivity to light, and also seizure, and also altered level of consciousness, bulging fontanelle, and the local rigidity. When we talk about the local rigidity, it is the neck stiffness. In next natin is the newborns may and infants may show these signs. We have high fever, constant crying, excessive sleepiness or irritability, a poor feeding, a bulge in the soft spot on the baby's head fontanelle, and stiffness in the baby's body and neck. For this one, this is a diagnostic sign to use to evaluate a suspected case of meningitis. Okay, the Brzezinski's neck sign and also the Koenig sign. For the Brzezinski's neck sign, it is a severe neck stiffness or neck stiffness causes a patient's hip and knees to flex when the neck is flexed. Okay? So kapag ka flex mo yung neck niya, okay, magfe-flex din po yung sa hips and knees niya. Okay? So that is the Brudzinski's neck sign. Okay, for the Koenig sign, there is a positive pain on passive extension of the knees. Ibig sabihin, ng passive, may nag-assist sa kanya. So kapag ka i-extend natin, okay, nagkaroon ng passive extension sa knees, there is a positive pain na mararamdaman ng patient. So that is the Koenig sign. Okay, for the most common strains of bacteria, okay, we have the Streptococcus pneumoniae or nagkakos ng pneumococcus. Okay, and Neisseria meningitidis, okay, we have the meningococcus, Haemophilus influenzae or the Haemophilus, and Listeria monocytogenes or the Listeria. Okay, we have the implementations. Okay, we have to do the isolation at least 24 hours after antibiotics are initiated. Okay, and also monitor the vital signs and the neurostatus of the patient. Aside from that one, we should also monitor the intake and output and assess for nutritional status and determine close contact of the child with meningitis. Bakit kailangan natin i-close contact? Okay, because meningitis is a contagious until at least 24 hours after treatment with antibiotics, the patient is sensitive to. Okay, so contagious pa rin siya. Okay, next one is the febrile seizures. Okay, for the febrile seizures, are convulsions brought by a fever in infant or small children. A rectal temperature greater than 100 degrees Fahrenheit or equivalent to 38.8 above. Okay, most febrile seizure occur during the first day of a child's fever. Okay, next natin is the factors for the febrile seizure. We have a young age, less than 15 months, during the first seizure. Okay, frequent fever, and also having immediate family members with a history of febrile seizure. Okay, during the seizures, okay, there is a losses consciousness and shakes, moving limbs on both sides of the body, okay, and also rigid, okay, or naninigas, or has twitches in only a portion of the body, and lasts a minute or 2 minutes. Okay, so next one is For next one is the picture natin ng tonic and clonic. Okay? When we talk about the tonic, ito yung first sign na nagpapakita. Ang after ng tonic natin, magiging clonic siya. That is the second. Okay? So for the tonic, nagkakaroon ng stiffening. Okay? Paninigas. Okay? Nag-i-stiff. And also, sa clonic naman, nagkakaroon ng rhythmical jerking. Okay? Nagkakaroon na siya ng jerking sa clonic phase. Okay? For the jerking, this is a fast movement that cannot control. So that is the two phase of the febrile seizure. So mas mauna pa rin si tonic bago si clonic. Okay. Next is the intervention during seizures. Ano ba yung pinaka-priority natin? Siyempre, yung safety ng patient. Okay, we're placed in a protected surface such as floor or ground, and also note be held or restrained. Hindi dapat sila nahahawakan during the seizure. Okay, and also bawal silang itali. Okay, baka magkaroon pa yan ng fracture. Place on his or her side or stomach to prevent choking. Gently remove any object from the mouth. Baka ma-aspirate or magkasugat pa sa may oral niya. Okay, look at your watch when the seizure starts. Last 10 minutes, ibig sabihin that is a medical facility na ang mag-a-assist dyan. Okay, so dapat alam natin yung hours ng seizure niya para alam nila kung matatansya nila kung gaano ni ka-severe na effect niya sa patient. Okay, and also, importante dyan is oxygenation din. Okay, aside from the safety, we have also to consider the oxygenation due to the ictal hypoxemia. Okay, for the ictal hypoxemia, it is a drop in hemoglobin saturation below 90% kapag during seizure. Okay, yun yung sabi ko sa inyo kapag ongoing ang seizure, ano yung bumabagsak sa vital signs niya? Bumabagsak po yung oxygen saturation ng patient. Di ba yung isang inassess natin is yung sa size ng pupils? Okay, so ang isang tinitingnan din natin is uh, yung oxygen saturation niya pag bumabagsak. Ibig sabihin, nagsiseizure ang patient natin. Okay? And the next one is the autism or the ADHD. For ADHD, muna tayo, what we call the attention deficit or the attention deficit hyperactivity disorder. Okay? For this one, attention or the ADHD is the most common, okay, most common behavioral condition or behavioral disorder of childhood. And one of the most prevalent chronic health conditions affecting school age, we have 5 to 10%, wherein there is a inattention, including increased distractibility and difficulty sustaining attention, poor impulse control, and decreased self-inhibitory capacity. Okay, for this one, they has a trouble controlling emotions and their behavior. Okay? Yung self-inhibitory capacity kasi nila, okay, yung poor impulse control nila, yung pagiging impulsive nila, hyperactive, inattention, or distractibility. Okay? Next is the motor overactivity and also motor restlessness. Okay. For the epidemiology, we have the studies of the prevalence of ADHD across the globe have generally reported that 5 to 10% of school age children are affected. And many children with ADHD also present with comorbid psychiatric diagnosis, including the oppositional defiant disorder. Okay, for this one, this is a type of behavior disorder, which is there is an uncooperative, defiant, okay, or the proudly refusing to obey authority. Okay, another one is the conduct disorder, wherein there is a difficult time following rule. Okay, and also there is a problem, okay, learning disabilities and anxiety disorders. Okay, who is at risk for ADHD, okay, or the attention deficit hyperactivity disorder? The average age of onset, which is 7 years old. Okay, boys are 4 times at risk than girls. For the causes, okay, it is not caused by vaccines or too much sugar or poor parenting. Okay? And it has a biological origins that are not yet clearly understood. Experts have found that certain areas of the brain are about 5 to 10 smaller percent smaller in size and inactivity. And also, recent research also like links in smoking, alcoholism, and during pregnancy to later ADHD in a child. Okay, other risk factors may include premature delivery and also very low birth weight and injuries to the brain at birth. Okay, sometimes studies have even suggested a link between excessive early television watching and future attention problems. Okay. For the etiology, evidence suggests that there is no single factor that determines the expression of ADHD, and multiple factors have been implicated. There is also an abnormal brain structures are linked to an increase of ADHD. Okay, for the pathogenesis, MRI studies indicate a loss of normal asymmetry in the brain and 5 to 10% reduction on brain volumes of specific structures such as the prefrontal cortex and basal ganglia. And there is also a low blood flow to the striatum. Okay, for this striatum, the input module to the basal ganglia, a neural circuit, a neuronal circuit necessary for voluntary movement control. Okay, another one is the fluorodopa. For the fluorodopa positron emission tomography scans have also supported the dopamine hypothesis through the identification of low levels of dopamine activity in adults. Okay, for the manifestation, clinical manifestation is the first subtype is the inattentive type. Okay, and often includes cognitive impairment and is more common in female. Okay, the second subtype is the impulsive or the hyperactive type. And then the third subtype is the combined type, kinong dalawa, are commonly diagnosed in male patient. Okay, for the diagnosis, we have the clinical interview and history. The clinical uh, interview allows for a comprehensive understanding of whether the symptoms meet the diagnostic criteria for ADHD, behavior, ayun, yung behavioral rating scales. Okay? For the behavioral rating scales, okay, uh, behavioral rating skills are useful in establishing the magnitude and the pervasiveness of the symptoms but are not sufficient alone to make a diagnosis of the ADHD. Okay, for the physical examination and laboratory, there are no laboratory tests available to identify the ADHD, okay, in children. Okay. And also, impairment, fine motor movement, and poor coordination and other soft signs. We have the finger tapping, alternating movement, and finger to nose, skipping, tracing a maze, and cutting out paper. Okay, further treatment is a psychosocial treatment and also behaviorally oriented treatment. And we have also the medications. The most widely researched medication used in the treatment of ADHD are the psychostimulant medication, including the methylphenidate. We have the Ritalin, Concerta, Metadate, amphetamine, and or various dextroamphetamine preparations. Okay? For the amphetamine natin or yung various dextroamphetamine preparations, these are CNS stimulant, okay, to increase the attention and decrease the restlessness of the patient. And also yung ating methylphenidate, okay, yung ating methylphenidate it used as a part of treatment program to control the symptoms of the ADHD. Okay, for the prognosis naman natin, a childhood diagnosis of ADHD often leads to persistent ADHD throughout the lifespan. And also, these risk factors include engaging in risk-taking behaviors like yung mga sexual activity, delinquent behaviors, okay, substance abuse. Okay? Pag sinabi kasi natin delinquent is, it refers to a juvenile behavior pattern characterized by a repeated offending. Okay, juvenile is a young person. So, okay, ito yung mga factors na gi-include sa risk-taking behaviors natin. Okay, next natin, after ni ADHD is the autism. Okay? For the autism, it is a complex development disability that typically appears during the first 3 years of life, and it develops and is typically diagnosed before the 36 months of age. And it is also characterized by a behavioral phenotype that includes qualitative impairment in the areas of language development or communication skills. Okay, and also social interactions and reciprocity and imagination of play. Okay, pag sinabi kasi nating phenotype, okay, pag sinabi kasi nating phenotype is, this is a observable characteristic. Okay? Okay, for the diagnosis natin, there is yung nasusunod dito para ma-diagnose siya. Okay, for the letter A, a total of 6 or more items from number 1, number 2, number 3, and also with at least 2 from number 1 and 1 each from 2 and 3. Okay. Sa diagnosis kasi natin, we have a letter A, tapos 1, 2, 3, then meron siyang mga subtype. Okay. Okay, letter number 1 dito is a qualitative impairment in social interaction as manifested by at least 2 of the following. Okay, we have a marked impairment in the use of multiple nonverbal behaviors such as eye-to-eye gaze, facial expression, and body postures and gestures to regulate the social interaction. Okay, we have the failure to develop peer relationship appropriate to developmental level, and lack of spontaneous seeking to share enjoyment, and also the interest or achievement with other people. We have an example by a lacking of showing or lack of showing bringing, okay, or pointing out object of interest. Okay? So, letter D, under ng number one is the lack of social or emotional reciprocity. So, number two, we have the qualitative impairments in communication. Okay, this is as manifested by at least one of the following. Okay, either dito sa A, B, C, and D. Okay, delay in or total lack of development of spoken language. Okay, not accompanied by an attempt to compensate through alternative modes of communication, such as gesture or my. Okay? And letter B, in individual with adequate speech, mark impairment, inability to initiate or sustain a conversation with others. Okay, next one is letter C. We have the stereotype and repetitive use of language or idiosyncratic language. Okay. Letter D is the lack of varied, spontaneous, make-believe play or social imitative play appropriate to develop mental level. Okay. Next natin, number 3, sa diagnosis natin, under ng letter A. Okay, this is a restricted, repetitive, and stereotype patterns of behavior or interests and activities as manifested by at least one of the following. Okay? Encompassing preoccupation with one, greater than one or equal to one stereotype and restricted pattern of interest that is abnormal in either intensity of or focus. Okay? Apparently, flexible adherence to specific non-functional routines or rituals. And also, yung stereotype and repetitive motor mannerism, example yung hand or fingers tapping on or twitching or complex whole body movement. Okay, letter D is the persistent preoccupation with the parts of object. Okay, sa letter B natin, delay or abnormal functioning in at least one of the following case with onset. Okay, with onset of less than age 3 years old, we have the social interaction, language as used in social communication, or the symbolic or the imaginative play. Okay, next one is the letter C. The disturbance in not is not better accounted for by Rett disorder or childhood integrative disorder. Okay. Next is the okay, for the clinical features impairment in joint attention. Okay, it is the inability to use eye contact and also pointing for purpose of sharing experiences with others. Okay. And for the it is a skill that typically develops by 18 months, and it is a impairment in proto imperative pointing. Okay, the inability to use pointing to obtain an object or desire, and also inability to proto-declarative pointing, wherein there is the inability to use pointing to an object of interest simply to have another share in the interest with him or her. Okay, next is may no eye contact and seem totally aloof. Okay, and show intermittent engagement with their environment. So that is the clinical feature. Okay, and also can range, okay, from being nonverbal to having a advanced speech, capable of imitating songs, rhymes, or television or commercial. Speech may have an odd prosody or intonation and may be characterized by echolalia. Okay, pag sinabi kasi natin echolalia is paulit-ulit. Okay, and a pronoun reversal, nonsense rhythming, and all other idiosyncratic language forms. Okay, intellectual functioning can vary from mental retardation to superior intellectual functioning in select areas. Okay, and play skills in children with autism are typically aberrant, characterized by little symbolic play, ritualistic rigidity, and preoccupation with parts of the object. Okay, so madami pa to. Okay, stereotypical body movement. A marked need to sameness. Okay, and a very narrow range of interests are also common. Okay, the autistic child is often withdrawn and spends hours in solitary play, and the ritualistic behavior prevails, reflecting the child's need to maintain a consistent, dapat, and also predictable environment. Okay, when we talk about tantrum, okay, tantrum-like rages may accompany disruptions of the routine. Okay, and also eye contact is typically minimal or absent to them. Okay, so the visual scanning of hand and fingers movement, okay, mounting of objects, and rubbing surface may indicate a heightened awareness of and sensitivity to some stimuli. Okay, for the etiology, okay, the exact cause of autism is still unknown but is believed to be multifactorial. Okay, with a strong genetic influence, we have the identical twins. Okay, identical twins, if one has ASD, okay, they will be affected about 36 to 85%. Okay, and for the fraternal twins, we have 0 to 31%. And parents who have child of ASD, okay, have a 2 to 18% chance of having second child who is also affected. Okay. For the ASD tends to occur more often in people who have certain genetic or chromosomal conditions. Okay, about 10% of children with autism are also identified as having Down syndrome, and almost half, we have 46% of children identified with ASD has average to above average intellectual ability. So, mas mataas yung ano nila, intellectual ability. Okay, next is the additional studies of neuroanatomy in children with autism have demonstrated anatomic changes in the anterior cingulate gyrus, okay, an area of the brain associated with decision making and the ascription of feelings throughout. Okay, and for the environmental factors influencing early brain development, we have advanced age at time of conception, born about parents, and maternal illness during the pregnancy. Okay, and also certain difficulties during the birth, particularly those involving periods of oxygen deprivation to the baby's brain. Okay, so for the incidence, one of 68 children, okay, boys are nearly 5 times more likely than the girls who have autism. Okay, ASD affect over 3 million individuals in the US and tens of millions sa whole world, okay, worldwide. Okay, for the diagnosis, we have the aberrant social skills development. It is the hallmark of autism spectrum disorder or the ASD. Okay. Okay, another diagnosis is yung checklist for autism in toddlers. We have the chat. Okay, is a screening tool designed for use with 18 months old children in primary care setting. Okay, so there is a no medical cure for autism. Okay, and for the autism triad, okay, autism triad of impairments, we have the social interaction, communication, and the behavior. For the social interaction, it exhibits poor or atypical eye contact, okay, and also failure to respond or has a delayed response to his or her name. Kapag tawagin mo is delayed talaga siya tumingin, okay? Prefers to be alone, okay? Does not seem to be aware of others or things or other feelings, okay? Fails to develop appropriate peer relationship. Okay, for the communication naman, it is a atypical. Okay, pag sinabi natin atypical, it is a not normal. Okay, atypical language development, little or no language abilities, and also may have marked impairment in initiating and or maintaining a conversation, may repeat words or phrases instead of normal language, and may demonstrate lack of make-believe or socially imitative play. Okay? So, for the last one here sa ating autism triad of impairment, aside kay social interaction, communication, we have the behavior. Okay? For the behavior, exhibit restricted, okay, or stereotype pattern of activities, interested, and behaviors. Okay, inflexible adherence to routine, strong resistance to change of routine or environment, and also may exhibit repetitive motor movement. Okay, and they observe interest. Okay, and also there is a unusual play and interaction with the object. So, yan yung huling ano natin, hindi na-discuss sa face-to-face natin sa under ng chapter 4, yung tira ng ating chapter 4. Okay?